This is going to be a very quick and dirty overview of hypertension or high blood pressure. So what is hypertension? It is a persistent elevation in arterial blood pressure. This does not have to do anything with the venous system or the veins. This is only regarding the arteries in the body. A normal blood pressure is 120 over 80, as I'm sure you are aware. The top number of 120 represents the systolic or the squeezing pressure when the heart is squeezing or contracting, and the diastolic is the 80, which is the pressure in the arteries when the heart is relaxed. So how do we stage hypertension? Well, it's pretty controversial, but the American College of Cardiology reinforces that a normal blood pressure is less than 120 and less than 80. Elevated or pre-hypertension is 120 to 129 and less than 80 on the diastolic. Stage 1 is going to be 130 to 139 or 80 to 89, and you only need one of those to qualify. And stage 2 hypertension is greater than 140 or greater than or equal to 90. Again, you only need one, the systolic or the diastolic, to qualify. So causes of hypertension, the vast majority of cases are primary or essential, which is an idiopathic cause, which means that we don't know what causes it. There are theories linked to excess dietary salt, but these are not proven. Secondary causes are more rare, and you basically have an underlying condition that raises the blood pressure, such as hyperthyroidism, aldosteronism, Cushing's disease, etc. Again, usually quite rare compared to primary or essential. So how do you take an accurate blood pressure? So you have to have the patient sitting quietly for at least 5 minutes, use the proper cuff size. The patient cannot have their legs crossed. They can't be talking, no chewing gum or recent caffeine or nicotine, as these are stimulants. You do have to have, for the diagnosis of hypertension, 2 separate readings on 2 separate occasions for the diagnosis. And you can also have the patient keep a log of their blood pressures at home, once in the morning, once in the evening, to differentiate white coat hypertension or white coat syndrome, which is when you have an elevated blood pressure only at the doctor's office. So when to start treatment for high blood pressure? Again, controversial, but the American College of Cardiology says that if you persistently have readings of greater than 140 or greater than 90, or if you're in a high-risk population, such as those with diabetes, chronic kidney disease, and have a 10-year risk of over 10%. General treatments, non-pharmacologic comes first for everybody. You want to have weight reduction, dietary salt restriction, smoking cessation, sleep apnea treatment, and regular exercise. These measures should be lifelong and not temporary. If non-pharmacologic does not work, then you go to pharmacologic. Typically, this is going to be a diuretic, such as a thiazide diuretic. You can also have angiotensin-converting enzyme inhibitors called ACEIs, or angiotensin receptor blockers called ARBs. You can also have calcium channel blockers, or CCBs. You should note that ACEIs and ARBs are not first-line treatment in African American patients. This is due to the increased risk of stroke. The goals for treatment, again, according to the ACC, are going to be a blood pressure of less than 130 and less than 80, which would fall into that category of elevated or pre-hypertension. Medication adverse events, what you want to monitor for are hypotension, especially orthostatic hypotension, which is hypotension with position changes, electrolyte abnormalities such as hyponatremia, hyperkalemia, pedal or dependent edema, which is swelling typically of the feet and ankles, renal dysfunction, acute kidney injury can occur, and the most, I would say, acute and life-threatening is angioedema for ACEIs and ARBs, which is swelling of the face and or airway, which requires immediate emergency intervention.